And we're live
Hi,
now,
we're
Nicole.
live.
Hey, everybody.
Hi, everybody. Welcome to Wellness Wednesday. It's a later time in the day for us on Wellness Wednesday, but here we
And
are.
we made it work this time.
I'm Mayor Mitchell Campbell. This is Wellness Wednesday, sponsored by A-Step, Arts Striving to End Poverty, where we bring the healing arts and the creative arts together, and we talk about it. This is well.
Hi, everybody. I'm Dr. Keith Bell coming to you from Richmond, Virginia, from my holistic health clinic. And we have a very special guest today. We have a friend, a lovely friend of mine, Dr. Amber Price. Dr. Amber Price is the Chief Operating Officer at TriStar Centennial's Women's Hospital and their Children's Hospital in Nashville, Tennessee. We're doing things a little differently today because in the past we focus on prevention for wellness, but we're bringing Dr. Amber Price in because what happens when you need help? What happens when we do everything that we can to stay well and illness still occurs? So we're going to be talking about that and how to navigate the hospital system. Welcome, Dr. Amber Price.
Yay! And I want to say, I actually know Dr. Amber Price because she and Dr. Keith came up to New York City and saw it was Mean Girls, right? That you saw?
We met you backstage. Yeah.
Yes. So, and then we went to a lovely wine and cheese dinner after the show, which was very fun back in the days of the Broadway shows, which I miss. But it's so good to see you on Zoom.
You too.
And you've moved, I believe, since
did.
the last time. When I saw you last, you were living in Richmond, Virginia, but now where are you?
I'm in downtown Nashville.
I love Nashville. Music City.
We love
Yeah.
it.
That's a great culture there. Are you loving it?
I'm loving it. I've been here 18 months and never want to leave. Love it.
Fantastic. So how has this whole pandemic situation been in Nashville? Like, how have you been coping?
Yeah, so I work for what is essentially the biggest private hospital system in the United States, and some overseas as well. So we have big databases across the country. So we saw this emerging kind of early on as a threat in different communities. I mean, of course, we saw New York immediately, and then we've been able to just kind of follow and anticipate where these trends are. Nashville quickly did emerge as a hotspot for COVID. And so we had our own concerns around how we're going to manage this and how our hospital is situated for this. And there's no precedent. So we as administrators didn't have like a textbook that we could follow. So we opened like a command center and then just started on a daily level, started looking at PPE and where do you put patients and how do you test and how do you get a test? And then what do you do with pregnant women? You know, you don't want to leave them alone. And what do you do with parents with little kids? You know, you can't have a child by themselves. So a lot of the early direction, we relied on the CDC and on state leadership to help us understand what we could do. And so, you know, we, just like everybody else, started figuring out how we could best do that. Now, my background is that I'm a midwife. And so I, at my core, believe that people have autonomy in healthcare decisions. And I'm a more holistic kind of thinker. I believe I'm the only one who's a senior hospital administrator. So I come from a little bit of a different wellness and holistic background. And for me, it was really important to keep support and transparency in place. So in my hospital system, from the very early days, we decided not to restrict visitation for women and children, even if they have COVID. And so I had some autonomy on that level, and I was able to kind of make that decision on this level and say, we're not going to be that rigorous. And so we've not ever restricted it. And so even if you come and have a baby and you're COVID positive, somebody will be with you, someone of your choice.
Wow.
And that has not resulted in any adverse outcomes. Nobody here has had a baby by themselves or has had a child that did not have support. And we're very proud of that now in retrospect. That was actually forward thinking. At the time, everyone was shutting the doors. And we're thrilled that we didn't have to do that. And so we have a little bit different data in the sense that we've never shielded our patients or the community from what was happening in our healthcare system.
That's really good to hear. I actually had some friends who went through pregnancies after the pandemic started, and it was a very scary time. I mean, a very scary time because they weren't sure if their partners were going to be able to be with them, and having to do virtual doctor visits. And I mean, it just all sounded incredibly sort of terrifying, actually, if you've never had a child before. So
yeah, it's terrifying. It's isolating. Birth is not something you do on your own. It's always a community event. It's very much like a wedding. People tend to kind of plan their whole lives of what they think that moment looks like for them. And it doesn't include being by yourself with strangers. And so we were acutely aware of that, and we preserved it. You make a great point around telemedicine. It works wonderful for a lot of my service lines that I have. It does not work for obstetrics. Women need their hands on their belly and be reassured. So I opened a tent in my parking lot and did drive-through obstetric visits. But we had to learn how to do that. You know, we had to figure out how you build those infrastructures and how you get that out to the public and how you reassure people. So we had to think outside the box. There was lots of stuff we needed to do around innovation. What helped us in that is that state law started actually letting up on some of the normal restrictions we normally have around telemedicine. I'm not sure if you're aware, but in many states you can't bill for telemedicine. And all of that got relieved when COVID hit because it was a necessity. And so we were able to open doors that we couldn't previously open to get to our patients, which has been very helpful in being able to do outreach and keep that up.
A tent in the lot, though, that's a creative idea.
That was pretty cool. Yeah.
Yeah, it was great. I saw there were pictures. I think the newspaper ran.
Yeah, it was widely publicized. It was innovative at the time. And now in retrospect, you look back and you go, it's just common sense, and it wasn't even that hard. You just need to decide to do these things, and that's how innovation works, right? You're brave and you just do it, and if it doesn't work, then you stop. But we just did it.
Right.
But you brought up a very good point, and I want to reiterate it. Is you come from a different background from many hospital administrators. You've come from a midwifery background, so you've given care in places that most doctors haven't given care. So a parking lot seems funny, but it's not the most unusual places that midwives have worked.
It is not the most unusual place where I've ever given care. That's true.
Because if I recall correctly, I mean, you had, at one point in your career chose, I know, but you chose to work in places where other people wouldn't go. I mean, you were working in New Zealand, I think Australia. You set up clinics in areas where there were no other caregivers. So do you think that puts you in a unique position to actually navigate what was going on for the healthcare system you're working for now?
Well, I think so. I think it's why I work for my healthcare system. That's what they're seeking out, right? Innovation in healthcare is important to change the healthcare system and move it forward. I have a doctorate in change leadership. I like change, and most people don't, because everything's your fault when you're a change leader. The quickest way to get hated is to change something people love, right? And I thrive on it. But yes, I, in my own experiences, have always kind of pioneered different ways of doing things. So the more you do that, the more you realize that it's okay to be wrong sometimes, and to just say, you know what, that one didn't pan out, I'm going to do something different. And the more used to it you are, the easier it gets to drive innovation and change. So for me, this was intuitive. For my company who's used to me, this was like, there she goes again. But it worked out, and then we used it across the company, and it was very successful.
That is very similar to ways artists actually do a lot of thinking. Okay, change leadership, a doctorate in change leadership. Tell me more about that. I've never heard of that.
Yeah, so it is actually a clinical doctorate through Johns Hopkins. Nurses have to implement changes at the bedside. For example, if you're a PhD, you're going to do research on some specific medical condition, but once you realize what the right thing to do is, how do you get that implemented at the bedside? We know it takes 10 to 15 years for research to translate into patient care. And so there is a clinical doctorate in change leadership, where you can cut that time down into a year and a half, so that we can quickly translate these medical interventions that benefit patient care by learning how to work within systems to get people to move into a different way of thinking and adopt new habits. So it's actually very clinical, but it lends itself well outside of the clinical realm as well. And it actually begins with the concept of understanding what your problem is, which once you delve into that, you realize most people get really upset about stuff, but they don't know what the actual problem is. I've always told Keith I want to write a book that's called What's Your Problem? So that I can help people figure it out, because people get mad about stuff, and I'm like, that's not the problem. The root cause of what you're mad about is actually something entirely different. So the specialty teaches you to think that way, understand how human behavior works, how people flow through change. Since I'm clinical, I know that particularly for nurses and doctors, there are entire theories on how they change and how they experience change. So that's what I'm an expert in. And so when I lead or build infrastructure or build policy, for example, I'm acutely aware of how I can implement that and how it affects people. It requires empathy. It requires understanding how difficult change is for people. But COVID was a perfect test. We had to do everything different. There's a famous saying in change theory that is that all change has to be forced. You can't sit back and wait for it to happen. And COVID forced change immediately for all of us in our lives, in our philosophies, in everything that we thought we knew. And so for change leaders, this was familiar territory. So we kind of emerged as people who were able to steer people through this with some support, because we understand the grief that comes with change, and we're able to support people in that.
And
I love that.
yeah, and in wellness and in holistic health, we're only as well as the society in which we live, or the system at which we work. And from knowing you, Amber, I know this has been a calling. Mary Mitchell, I don't know if you know this about Amber, but changing the healthcare system to be more equitable and patient-friendly has been a calling for her, because it's a personal calling. Can you talk about how you're first dealing with a patient who didn't want to be a part of the system?
Yeah. So my mother, I'm originally from Holland. My mother was diagnosed with breast cancer when I was about 13 years old. And my mother was absolutely terrified of the healthcare system, did not participate in it. We were all born at home, just had an innate fear that actually came, she was born during the Holocaust, and she had a great fear of authority in general, and people telling her what to do. Did not do well with that. So she did not engage the healthcare system, stayed home after the diagnosis was made, and died a very slow, agonizing death that I witnessed as a young teenager. And it really built my conviction to be inside the healthcare system, so I could drive that change. I didn't want any woman to be afraid to seek care, and I didn't want another child to have to watch their mother die because of fear of utilization of the healthcare system. So everybody goes into leadership in healthcare for a different reason. We call it our connect to purpose. And it's the most interesting question you can ask a healthcare administrator, particularly ones who are on a senior executive level. What gets you there? You will find it's almost always a very personal story. And for me, it's that memory of watching somebody suffer out of fear that was probably founded in the moment. So when I build a healthcare system, or when I build a structure, accountability becomes important. There's a zero tolerance for not, focusing on people's personal desires and wishes. And we uphold that strongly, and that benefits the healthcare system for everyone. Now, women in particular are really important healthcare consumers, because women make 80% of the healthcare decisions in America. They make healthcare decisions for themselves, for their children, for their partners, for their parents often, and that's often been overlooked. So if you're not an expert in healthcare, or you're in a field that's driven by men, which healthcare overwhelmingly is, often spaces, policies, and everything else is designed specifically for men who are not the drivers of healthcare choices in our country. So being a woman, coming from this background and having that unique understanding is the reason that I lead women's and children's hospitals. That is the entry point for most patients for their first interaction in the healthcare system. Often women's first hospitalization is the birth of the child, and that is an entry point into the healthcare system. And I can make sure that they understand what partnering in healthcare looks like, what great consent looks like, what being heard looks like, what being seen for your own individual background looks like. So you're not getting that cookie cutter care, or that what we call directive care, where people tell you what to do, but we elicit your partnership. Once people recognize great healthcare, they recognize it forever. And so that is something that then sets people on a path of being great healthcare consumers and advocates for themselves and their families. And that's my goal. That's why I'm a healthcare administrator.
I would like to be a patient in your hospital system. Not that I want to be a patient in the hospital, but I would definitely like to be in your system.
Well,
that's amazing.
Yeah, it feels very different when you walk in the door and somebody sits down with you and doesn't stand over you. Sometimes it's in the little things, and so we underscore that, and we work really hard on helping our own staff understand what it's like to experience healthcare as a consumer walking in the door. So there's very transparent conversation around that.
Do you have advice for people who are not in a system that is perhaps as wonderfully involved as yours? And like, I have friends, I have a lot of women friends who are not white, who are people of color, or and they've struggled to be heard in hospital systems. Do you have any advice for that?
Yeah. So I actually wrote a book chapter on this exact topic in a book that came out very recently. It's called Nobody Told Me About That. And I write a chapter on voice. And I talk about how you find your voice in the healthcare system. A lot of it is being literate in healthcare, is understanding the words, the buzzwords, the things that stand out to people, to understand that you're trying to communicate something that's urgent. Often people will say something that it doesn't register in the mind of the healthcare provider as an urgent discussion. And so I teach people how to use our language and how to alert people that you're very, very serious about what you are saying. I think people often forget that that you are contracting the people who are in front of you, and you don't lose your rights when you walk into a healthcare system. I think the healthcare system sometimes can be overwhelming for people, particularly if they've never navigated it before. Everyone who goes into healthcare has good intention. Everyone wakes up in the morning trying to do the right thing. What we're seeing now with so much attention on the healthcare system and fear that's being instilled around I'm going to get terrible care is that people come in on the offensive. And they're coming in already convinced that somebody's going to miss something or isn't going to care for them. Stay open, come in, have these open conversations, learn a little bit about how to have these conversations with healthcare providers, insist on personal relationship. So I often tell people, don't assume that you can't ask a personal question of your healthcare provider. Sometimes that's the best thing you can do to kind of break through this distance that you're feeling. If you don't feel heard, use those words. I do not feel heard. Be very clear in your communication. Rather than being accusatory, just feedback what's not working for you. And then he said, I'm not understanding what you're telling me. Well, I just don't feel, I understand what you're saying, but I don't know what that means. And be very clear about what isn't working for you. I find that most healthcare providers will then slow down and take a little bit more time to explain it. There's sometimes an assumption that the care we're giving as healthcare providers is, it's implied that we're doing a good job, and we don't often elicit response from our patients to make sure that that was what they were looking for when they came in. So we work on the other side with physicians and with other healthcare providers to say, hey, can you make sure that you're asking the patient that what they thought they were going to get actually happened today? So both sides need to ask for clarity, and that goes a long way. Don't be intimidated. They're human beings that put their pants on one leg at a time. And if you did not understand what happened to you, or you were too sick to understand what happened to you, just keep asking the questions over and over. If you still do not feel that you're heard or that your needs were not addressed, you need to escalate it in the moment, ask for a leader. Every hospital has either a patient advocate or a leader who will come and see you while you're an inpatient to help you clarify what's going on with you. That's your right as a consumer.
So I know that a lot of people do go into a hospital system. They're afraid, obviously, and they're confused. And then you get all of these forms, these informed consents and things you're supposed to fill out right then. And I think people are afraid to ask for clarification, or even for someone above them in leadership roles, because they're afraid of kind of retribution. I mean, can you speak to that?
Yeah, no, I know that. And I see that a lot. And, I see it usually after the fact. Like once somebody's completed their whole hospital stay, then I'll get a phone call and I'm like, why on earth did you not say anything when the 10,000th leader showed up and asked how your care was? Well, because I didn't think, I didn't want to stir the pot while I was there. We want you to. So every hospital has a built-in safety net. Every hospital has a risk management system. Every hospital has an advocacy group. Every hospital cares about its patient experience scores. That is how the senior leadership structure of a hospital works. They want to know if things are not going well. There is no retribution in the sense that you're not suddenly going to get terrible care. It may mean that a leader will have a conversation with a physician or a nurse, or switch them out. One of the easiest things to do is to ask for a different person to care for you and to say, I'm really sorry, I just don't think we're clicking. That works well. Now, consents and Bill of Rights are different things. So every patient in the United States has rights. Every human being has rights walking into anything. You can refuse anything. Nobody can do anything to you don't want to have happen to you. That is your right. In the hospital, there's something called the Bill of Rights, which is something that is usually included in your admission packet. Look for it, if not, ask for it. What it essentially says is, we're here to take care of you and make sure that you are well. What we ask of you is that you're transparent with us so that we know how to treat you. That's really the basis of that. Everything else around that, you're not signing your rights away when you sign consent. What you're signing on most consents is an understanding that we're here to treat you, and you're telling us it's okay to touch you. You're writing that down and you're saying that conversation happened. That's really what consent is in the hospital. There's nothing that you're signing that denies your right to anything that is important to you or that signs something away. So don't assume after you sign consent forms that you can't change your mind on something. A great example is, you can sign a consent for blood products, for example, but if it gets to the point you have to make a decision on a blood transfusion or not getting a blood transfusion, in the moment you can refuse that. It's not that you signed your rights away.
Okay.
So it just means that if you go unconscious and we need to give you blood, you've consented for us to treat you. But as long as you're of sound mind and you're conscious and you can have conversations with us, we urge you to do that. We're not psychic either. And we appreciate people who have great conversations with us and not assume that we're out to get you. So keep those lines open early on. And again, use the right words. If I'm afraid, or I'm not understanding what it is you're telling me, those are the right types of sentences to use so people understand what your issues are and that you're not just angry with us. Use the right words. I say that all the time. Umbrella terms are important. And what I mean by that is, Keith knows this, my platform is respectful maternity care. You can be upset about one little component of that, but if you use the right collective terminology of that, it goes a little bit further. So again, know the language of the healthcare system a little bit before you enter it. If you call something a welt when it's really a hive, that could cause confusion when you're talking to a healthcare provider. So do a little bit of research before you go in so that everything you're saying makes complete sense to a person who actually speaks a different language than you.
Right. That makes a lot of sense. Where do you recommend doing that research? Just online?
Yeah, I mean, you can just, look online. It's really more around the word choice. And in my chapter, I write about that. So if you say to a doctor, after you have a baby, for example, my bleeding is heavier than when I left the hospital, that's very different than saying, I'm soaking through my underwear and it's dripping into my shoes. And, that is a very different level of discussion. So it's the trigger words. It's these things that get people to understand that something very serious is happening with you that are important. And you don't always need to know medical terminology for that. It is just an understanding of, if I were in that person's shoes, how would I know how bad it is when I'm just talking to you on a phone or coming in and I'm trying to describe my pain to you. Start thinking about that before you go to the hospital. How would you describe that? Often we say, describe your pain on a level from 0 to 10. Can't tell you how many people say 10 and they're chatting on their cell phone. So be a little bit more specific in your answer than, it's like a 5. To say it feels similar to. People use things like stubbing your toe, for example, or, the worst headache you've ever had in your entire life. Describing pain in the way that any other human could relate to that out of their own life experience can really help somebody understand what you're really saying rather than 5 or a 6.
Right.
That's very helpful. I often find in times when I'm dealing in the medical community that I don't use my words as well as I should. Mostly from a feeling of feeling overwhelmed and I think maybe what you were just alluding to is like taking back your power, but like I get disempowered in a way where I just sort of don't want to say anything and then don't use my voice, which is exactly what you just explained. So that makes a lot of sense. As like a reframe.
Your own prior experiences in the healthcare system, all of that comes out every time you visit. There's we know there are certain populations that experience that more acutely than others. Any underserved population, HIV positive patients, people who are morbidly obese, women of color, people who come from, socioeconomic backgrounds where, it's just really, really difficult to navigate any kind of system, much less a healthcare system. But women in general, every time you have an encounter with a healthcare provider, sets you up for that next encounter with a healthcare provider, and it all comes rushing back to you when you go in. Again, that clarity and communication, particularly a nurse, who's a little bit more connected to patients at the bedside, and say, I'm really scared of the healthcare system. And I don't even know what it is. I just feel silly, but I almost feel like I can't speak up. Just saying that alone helps a nurse understand that she may want to stay with you in the room when a physician's there, so she can kind of help facilitate a conversation. Just be transparent. It's easier for any physician to know that there's a hesitation rather than thinking that you're not forthcoming or that everything's okay. Speak up and say something, and it helps all of us. In my hospital, on the women's side, the physicians wear badges that say, I'm listening, because that alone breaks down a barrier, and it makes it easier for people to speak up. And they don't do anything different than they always do. It's just easier for people to say something if somebody wears a giant sign that says, I am listening to you.
That is really beautiful.
Yeah.
We all should wear those sometimes.
Yeah.
Seriously.
But you talked about respectful maternity care, and I remember at one point when you were working And you talked about marginalized women, especially women of color, and obese women. I remember you were working at one point on labor and delivery, and um, there weren't tools and instruments designed for women of a certain weight.
Correct.
Is that change? Can you talk about that and how you're working to make changes more
Yeah.
equitable to people of color and
Yeah.
marginalized people?
So first, it's creating awareness. So as a change leader, I go in and actually let people know we have a big problem here. You got to collect your data. So when I pulled the data in, and I worked for two different healthcare systems on the same premise. Once we started pulling data and to look where maternal mortalities were occurring, what the racial disparities were in that, and where the BMI sat, we learned all kinds of stuff. We learned that 52% of women who come in to have a baby are actually obese. And that is something that we really didn't know when we first started looking at this. Because when you're very heavily pregnant, it's sometimes hard, to get your brain to register that this is obesity. What we know is that women who are obese and who are pregnant are at higher risk for clots. They're at higher risk for hypertension and other conditions that are potentially dangerous in pregnancy. So, but if you know that, then you can mitigate that, and you can actually still give people perfectly good normal births around that. So one was awareness. One of the things that I did is implement actually a survey for our nursing staff to just kind of get a baseline knowledge, and then started implementing really basic change with a different monitor. And I had to partner with a company out of England, and that monitor is now on the market in the US, but it works better on people with a high BMI. But when we asked our nurses to put that monitor on women with a high BMI, what we found is that nurses didn't recognize high BMI until the patient's BMI was over 40. Now, BMI of 40 is fairly high. It's an average 5'7" woman who's nearing 300 pounds. So that's when nurses started to recognize obesity. So you're missing an entire giant piece of the population that could benefit from different interventions to promote wellness. And so once we pointed out to the nurses that there's a big gap in what they were recognizing as a group of women that feels marginalized, that gets treated differently, that has different healthcare experiences, then that light bulb goes on and you can go and help them. Then you have to teach people how to talk about really uncomfortable things. One of the things we're all doing in the healthcare system now is bedside report. Back in the old days, the nurses gave report at the nurses station. They talked about you to each other. And it allows you to, sometimes insert things that are a little bit inappropriate, or, she has a history of substance use, or all those things. If you're doing it in front of the patient, you're going to have a different conversation that engages the patient. So in our hospital system, we've moved all of these discussions have to happen in the presence of the patient, so that you're partnering in the discussion. And then the nurses and the doctors have to learn to speak about conditions we often judge people on, like obesity, like substance use disorder, frankly, in front of the patient. And that has changed the healthcare system. So hospital systems that enforce that are retraining how we talk about really sensitive topics. So nurses had to learn how to talk about, and to women who are morbidly obese, about their obesity. And most nurses didn't know the right words to use, or how to not put someone on the defensive, but they have really positive conversations around that, because believe it or not, women who are morbidly obese actually have phenomenal birth outcomes if we do certain things well with them. You're correct, Keith, in that the right equipment is difficult to find for people who are not cookie cutter and fit the mold. That's what the medical system's built on, mostly for men, actually. And so the right gowns, equipment, blood pressure cuffs, monitors aren't always there. So it takes healthcare administrators who kind of get that and go searching for it. And we did have to rebuild the hospital. We had to work innovatively with companies who had already solved for these problems, and then implement them and get the staff to adapt it. And what we saw was an immediate shift to wellness, reduction in maternal mortality rates. My maternal mortality is 0, and we don't see racial disparities in our system. So you can do that, but it takes transparency, and it takes innovation, and it takes just pushing it forward to the next level. I'll tell you, it's very satisfying for healthcare teams when they get to be involved in the type of change that yields phenomenal results. So, it feeds itself, and people get enthusiastic, and then they want to go do something else again. So it's a great example of that. But consumers, if you walk into a hospital, you can drive those things too. If something didn't go well for you, make sure that they know it didn't go well, so people start to understand there's an issue that they need to pay attention to. Every hospital wants people to come to them and not to the competing hospital across the way. And so often your voice is really important. I always tell people, don't leave negative reviews on social media to a hospital. It's not a great way to do that. You can leave, if you want to talk to a hospital and you don't know how to get hold of someone, or you tried and it didn't work, go on social media and say, I would like someone to call me. every hospital will jump on that and call you right back because they're not sure what's going on. And they'll connect you to the right person from there.
Oh,
Great
wow.
advice. Really great advice.
Yes, we want the feedback, and don't assume that we don't. We really do.
I like how passionate you are when you talk about all of the ways that you've changed systems and gotten great results, but also it's great to just hear your willingness to change systems, which I think is really what it comes down to when you were talking about innovative thinking and change leadership. It's very exciting.
Well, when someone says the word healthcare system, I take that personally. That's me. You're talking about me. I'm a healthcare system leader. And I feel very positive about the American healthcare system. I think we actually do a phenomenal job. I think where we can improve is this component. It's autonomy and communication. I think the actual healthcare that we have in our nation is phenomenal. And I think people underutilize it and are afraid to use it and don't know what to ask for. But once you know how to navigate this well and have good connections, you're going to find that we actually, enjoy a really good healthcare system in our country. We're proud of it.
Wow. What do you have to say to people, or what can you say to people right now who, there are a lot of people afraid. They're afraid to go to the hospital. They're afraid to go to the doctor's office because they're afraid they're going to get sick or they're going to get COVID. Can you talk about the safety of, not only the safety of the system and the space, but when a person really should reach out and get help?
Yeah, it's a great question. So we've learned a lot in the last 6 months about this virus. It is just a virus. I'm just going to say it like that. It's just a virus. We know how to prevent transmission of any virus. We learned in the healthcare system that when both parties were masked, right? So if someone came into the emergency room, put a mask on them right outside the door, then they came in, and the healthcare provider was also masked, that we did not see transmission of the virus in that setting. It happens, but it's very, very rare. Sometimes maybe if somebody has a real high viral load or is like a super spreader, but overwhelmingly, that is not where COVID gets transmitted. If both parties are masked, the interaction is more than 6 feet apart and less than 15 minutes, we're not seeing transmission from that. It works that well. Where we see transmission in the hospital is when people take their masks off in the break room, or we're having lunch together, or outside of work somewhere. It truly is like any other virus in close proximity to someone for a prolonged period of time, particularly with forceful exhalation. So it's a laugh, it's a cough. The reason that people get it more in bars and in churches it's singing, and in bars is because you have to speak really loudly to be heard by the person next to you. It's the force behind it and the proximity. So you can do a whole lot about not getting COVID yourself just by practicing those very, very basic rules. Hand hygiene is important. And then the other component of the mask is that you're not touching your own nose and mouth. So we practice that religiously in hospitals. We get to enforce that here. And so we have this data for 6 months. We know it works. There's really no question, regardless of what social media tells you, it works really, really well. So if you come into a hospital now, what you're going to encounter is a screening table. Every hospital is pretty much set up like a barrier at every entrance where somebody takes your temperature and asks you a list of questions to see if you're on the potential COVID side, or if you're for another reason, or you're visiting. And so everybody kind of screens out who walks into the hospital. So you'll be given a mask. It's okay to wear your own mask from home because cloth masks do work well. And then they're going to figure out where you belong. If you come into an emergency room because you do think that you potentially have COVID, you will immediately be isolated because they'll have already assessed that you need to be in a separate space. You'll be asked to keep your mask on. The people who come in will have a little bit of higher level of masking at that point. And they're just going to talk to you and figure out what's going on with you. The positive testing rate, meaning of all the people who get tested, is somewhere between 6 and 8%. So, the rest of you at 93% are not going to have COVID. It's just the crud, or it's an allergy, or it's something else. So it doesn't mean that if you have every symptom that it's COVID. But if you do test positive, what we know now that we are so far into it is best practice. We've learned over the past 6 months what works really, really well. We know which medications are helpful. Overwhelmingly, people do fairly well with this virus, and we've learned how to manage it well. There is a component of people that gets very, very ill. So seeking care early is actually one of the key components of that. Is getting in there early so you get the right advice early on, so you learn what your warning signs are. And now you have a relationship, and that goes back to that voice in healthcare. Now you can call back to the place where you just were, and you have a little bit of a relationship, and it gets easier to make that next step when you do get scared and need to come in. We've learned of new things that, were on our radar for cardiovascular disease that are now coming into the COVID realm. One of those things is called ECMO. ECMO is essentially a heart lung machine. It pumps the blood outside of your body so your lungs can rest and your whole cardiovascular system can take a break, and it allows your lungs to heal. So we're now using technology that before we would have never thought of to use in a virus. It's very effective, and we're starting these things earlier on in the process. And overwhelmingly, the survival rate is very, very high. Now, the bar for healthcare is not I lived, right? That is everyone's minimum expectation. So we want to do a lot better than that, obviously. But I think, we know that if you do get care and you do come in, that most people do well and go home to be with their family. There are, to your point, Mary, there are disproportionate populations that don't do well. The people who are forced to work, constantly in the face of the public, who have no other way of isolating and don't have the luxury to put those measures in that keep you safe. Those are the people that we see getting exposed more. They often don't have health care. They live outside the system. They're really delaying until the last minute, and those people don't fare as well. Plus, those are the people who have long histories with healthcare systems where they weren't heard and don't advocate for themselves or their family members. So hospital systems that are acutely aware of that will address that. So in the policies in my hospital, it spells it out. If you're African American, if you're on Medicaid, if you have any kind of a mental health or substance use disorder, we bump you up in an acuity level. It makes us pay more attention to that patient because it flags us that we have to be extra careful with that patient population. But those are deliberate conversations that administrators need to have with their staff.
Wow. So do you recommend doing a telehealth sort of to decide to go to the hospital, or do you think, or to the doctor, or do you think just err on the side of caution and go at this point in the pandemic?
Well, I think telehealth is great. I think any physician that you talk to or a nurse practitioner via telehealth is going to tell you to go to the hospital if they're worried about you. That's their job. I think it's a great first step. I think anytime when you start to feel scared, you need to go in. If you have a question, you use telehealth. If you're scared, you need to go in. Trust your gut. You know your body. You are the advocate for your own body. Just go in. Hospitals have different visitation policies. Here in my hospital, in the ER, you get a visitor. So you may want to shop around a bit and see who allows a visitor, and then go with someone who can support you and be your voice if you're too scared to speak for yourself. And make sure that they know that what you want and what's important to you. Have an advocate with you. It's easy for us to understand what your needs are if somebody's able to translate that to us as well. We want to give good care. But because it's so varied, I would just, make sure that you have a little bit of a plan. If you have to go to the hospital, figure out which healthcare system you want to use.
Yeah, I was just thinking I need to have a voting plan. I was like, oh yeah, it sounds like, you need to have a medical plan. I've always heard about having an advocate with you. You mentioned earlier about asking for a patient advocate. Is that something you can ask for within the system?
Most healthcare systems have a patient advocate who's employed by the hospital. People don't know that, but
I did not know that.
The case. And so if we have a patient where we just can't resolve an issue, or we really want to do something and the patient really doesn't want it, and we're worried about your life, or there's an ethics issue, or your experience just keeps getting worse, then the patient advocate steps in. That's the person who understands the hierarchy in the hospital, who we need to loop in. Does this need to be a physician leader? Does this need to be a hospital leader? Does this need to be a nursing leader? Like, who do I need to pull in to make sure that we can resolve this? And that advocate is there for the patient and helps you navigate the healthcare system. So you may want to look around and make sure that the hospital you go to has a patient advocate. That is a nice neutral party for you to engage without having to confront anybody yourself. You can say, can I talk to the patient advocate for a little bit of guidance? And anybody in the hospital will make that phone call for you and get the patient advocate in front of you.
Wow, that is I never knew that, but that is amazing information.
Yeah. Unfortunately, it's often utilized when we're way down a path where resolution is impossible. And it'd be much better if people could, engage that a little bit sooner so that we avoid that in the first place.
Right.
As an administrator, it's my role to go into a room when somebody's absolutely irate about something. And almost always I think to myself, if I had been here 3 days ago, we wouldn't be here right now.
Right.
Everybody, there's a whole nother topic. Keith and I talk about this all the time, but punitive work environments, right? Sorry, I don't want to take that call. Work environments are toxic. And I talk about this all the time. When I come into a healthcare system and I'm their new leader, I often have to work through this history that was there was punitive, where a doctor would come in, scream at the administrator go yell at a nurse, and then somebody gets fired. It's really difficult to restructure that. Parenting in the United States is fairly punitive, right? In America, people are fairly punitive parents, but to be a non-punitive leader or a non-punitive parent is tricky. But building hospital and healthcare systems that are non-punitive to physicians, to nurses, and to patients, that's a really interesting thing to think about. So that's the premise that I use. It takes a long time. It probably takes about a year to change that culture. But when people start to understand that you can come forward and have an issue and nobody gets mad at you, and you don't get fired, and it's just seen as an opportunity for improvement, that's where you're driving innovation, and that's where you get engagement from your physicians and your nursing staff, because then they feel like they can speak up and advocate better for their patients. I mean, if a nurse can come in here and say, I just think we should be doing this, and before that was something that you got in trouble for, you're never going to change a system that has leadership at the top that punishes people. So you want what we call a culture of safety, and a culture of safety means that you don't need to be afraid for your job or for being punished for bringing up an idea or a concern. And that translates to any other business or health or any other business or system or philosophy, but it works phenomenally well in healthcare. So that's the premise that I lead from.
So I'm curious, I'm going to use Mary Mitchell's I'm curious, because she's always curious.
I am.
I'm curious as to, so you came into this brand new healthcare system in a city that you didn't know. Well, you were there exactly 1 year before this pandemic hit.
Yep.
What have you learned about running your own hospital system during a pandemic? What has it taught you?
Yeah, you don't do it by yourself, right? So we have a whole team of people, and we just engaged each other and immediately leaned on other senior leaders for support. And I do it for a big company, and all that support came down to. So I do want to make it clear that you don't do this in isolation. You actually rely on your relationships and your teams and people that you trust in order to do that. It's important to be brave. You can sit back and do absolutely nothing and just let a wave wash over you and watch things happen that don't feel good to you, or you can, stand up and decide that you're going to take a stance on something. So I'm born this way. So I took the stance that no matter what, we were going to preserve autonomy, no matter what, we were going to preserve support. Once you decide what you're going to keep in place, everything else around that falls into place. Every time there's a new thing that comes up from the CDC or from the state or from the governor, you can bounce and change those things pretty easily as long as you stick to your core premise of who you want to be and how you want to be remembered. I posted something early on, Keith, and I think you shared it, is after all this is over, what people are going to remember most is if you were kind. And so the kindness that we extend to one another, people who are going down the conspiracy theory rabbit hole, people who are, becoming, super politically involved or whatever that is, we have to be kind about that because everyone deals with stress in a different way. So we made that a premise. We're going to, whatever people throw at us, we're just going to be kind about it and work through it with them. Somebody comes into my hospital and says, I will not wear a mask. I feel like you're microchipping me, and it's a muzzle. Then we're still going to be kind, and we're going to have conversations and educate and work around that. So we made a decision early on to come always from a place of goodness and kindness when we're dealing with people who are afraid. Once you do that, then everything else falls into place. So we stuck to those premises, and we've done that to this day. To this day, if someone comes into our hospital system and it's a really big extenuating circumstance, the administrator who's on call that day will take the call and we'll do a resolution that's in the best interest of the patient. So we're constantly making exceptions because it's the right thing to do. And it comes from a place of kindness. I'll give you a great example. We had a family here not long ago who lost a baby. They had 9 other children at home. We let all 9 children in to meet that baby. And of course that violates the restrictions for visitation, but we made sure we had a safe space. They weren't around anybody else. You just go out of your way to make sure you do it. You just make a commitment to doing the right thing. And when you do that, you find a solution.
Right.
And you earlier talked about empathy, which I think is also such a big factor in everything you're discussing. Yes. And it's such a big factor as an artist. I feel like we delve into teaching empathy through art and storytelling about people that are not like you. And I think that's what's so beautiful about what you're describing is kindness and empathy.
It's not hard to instill that in any profession, and in healthcare, it's the most important thing. Everything is heightened in the hospital. If you can't find a parking spot at the mall, you're irritated. If you can't find a parking spot at the hospital because your baby's dying, imagine your stress level. So everything is amplified 20 times. And when you work in healthcare, we're acutely aware of that. If there's a little bump in our hallway, Normally you wouldn't notice it. If you're the patient on the gurney and you're going over that bump, it's the biggest bump in the world. So our whole world is a little bit different in that we have to understand that amplification for the people who utilize us, and the stress levels just walking in the door. So it takes a special person to be able to navigate that. But you're right, it has to come from a place of empathy and constantly being able to put ourselves in the place of others, and leading from that place to our staff as well. Staff, Keith talks about burnout all the time. We don't want to burn out. We don't want to, you lose that empathy just because you go numb over time. I want nurses who cry with patients. I want doctors to drop everything just to sit with someone. And that's something that you need to, foster in your culture. And that's okay. We're often taught that it's inappropriate. It's not inappropriate. It's why I said earlier, ask personal questions of your healthcare provider. It breaks through that barrier, and it gives them permission to be more personable with you. Do you have children? What was your own birth like? These are questions that I, tell women to ask healthcare providers. Have you ever had this happen to you? What would you do if this were your daughter? These are personal questions that work really well, because it gives the provider an understanding that you're looking for more of a relationship. So use that.
And how your job sounds very stressful. How have you been dealing with like your own, what have your coping skills been? How have you been coping?
Yeah, it's deliberate. I know the stress of my job. My phone has probably rung about 8 times since I've sat here and talked to you.
Yeah.
For about 5 messages now, and they're probably all fires that I need to go put out. But
Yeah.
I thrive under that. One of my least favorite questions is, what is your work-life balance like? I don't have any. I made a deliberate decision to run a hospital, so I don't really have that. And I deliberately do this every day because I love what I do. I make time for myself. It starts Saturday morning, goes through Sunday night. I go off hiking, I go off grid. So I hike in the middle of nowhere all weekend and just make myself decompress, because I know that's what I need to do right now while times are especially stressful. And so that's how I cope with it. Self-care is important, and I just block that weekend off for myself. Any other time, I'm available 24/7 to everyone.
Again, I would like to be in your hospital system. In the interest of time, Keith, should we run to our lightning round? Did you have something else before that?
No, I have nothing. Amber, now is lightning round questions. Mayor Mitchell has a list of questions for you. Just say the first thing that comes to mind.
Yeah.
All right.
Don't be nervous. Don't be nervous. All right. What is your favorite thing to do for self-care? I think you may have just answered it.
Hiking. I know that.
What do you love to do first thing in the morning?
Make a cup of coffee and watch Say Yes to the Dress, believe it or not.
Okay, the coffee was expected. The Say Yes to the Dress was not, but I enjoyed that.
True story.
Because you don't even wear dresses.
I don't. If there's something about the neutrality of that TV show where, I'm never going to encounter something that's going to throw my day off. It's always going to start my day right. It's predictable. I get a little randy. It's all good. I get 30 minutes Say Yes to the Dress with a cup of coffee.
All right. We'll check it out. What's your favorite food?
Well, I'm on a diet. I've been on a diet for 10 months. I've lost 110 pounds.
Amazing.
It's pizza. That's what I think about every day.
Okay, beach or mountains?
Beach.
Where do you think of as home?
Virginia, on the water.
Okay. How do you deal with being angry?
I talk it out.
What sound do you love?
Rushing water.
And last one, if you were a spice, what spice would you be?
It's gotta be chili pepper.
That sounds right. Chili pepper sounds right. Oh my goodness. Well, I know how busy you are and you have 1,000 messages to go to, but thank you for like breaking this down and explaining it in a way that people like me can understand it. And I already feel better about going into a hospital.
We all have good intent. Every morning, everybody in the healthcare system wakes up trying to make the world a better place. And if you keep that in mind when you walk in, and you'll have a different interaction.
Amazing. All right.
Thank you, Amber, for joining us. Thank you, Artists Striving in Poverty. Thank you, Mary
Everybody
Mitchell.
have a great week.
Have a great week.
Thank you.